Good afternoon, esteemed colleagues and friends. I'm glad to be here in this wonderful congress, rich of appreciated speakers and lecturers. I would really like to thank the organizing committee, the scientific committee, and the Vietnam Odontostomatological Association, as long as UNIDI, Italian Union of Dental Industry, and 88 Dent for the support. I will briefly report on behalf of Italian Society of Dental Aesthetic Medicine and Italian Association of Regenerative Medicine on such emerging topic because aging of lower and medium third of the face causes a progressive prolapse of the skin, a reduction of adipose tissue, and an alteration of cellular metabolism. Treatments and rejuvenation of the oral and perioral region can be very challenging because of the many factors that affect the appearance of these areas, such as oral and dental related factors, aging, muscle movements, smoking, sun damage, and finally anatomy. The consequence of the above-mentioned reason is that actually the clinician needs all the more advanced instruments to treat properly and in a minimally invasive way the oral and perioral region. Between these instruments, slowly developed and diffused in last quarter of a century, we cannot list PRF, sonic instruments, intraoral scanners, and certainly lasers. Due to the limited time of this speech, I will only introduce the first two technologies, hoping this could be a topic maybe for the next year conference. Sonic instruments have been recently used in oral surgery and in many fields of dentistry. These instruments share many advantages with ultrasonic handpieces and can be connected to dental unit easily because they work by means of compressed air. Their frequency ranges between 5 and 9 kHz, and thanks to this compressed air, the tip can oscillate between 100 and 250 micrometers in space, providing a selective, precise, micrometric cutting action. Thanks to a micrometric precise oscillation mechanism, these instruments have been used successfully in periodontics, in endodontics, orthodontics, and prosthodontics. In oral surgery, they are especially useful for surgical extraction, for bone surgery, due to their limited temperature increase. But not only, they are also useful for bone block harvesting, for bone expansion, and finally for implant site preparation, providing to the surgeon a really three-dimensional micrometric vibration suitable for a very precise and controllable bone cutting action. Another interesting innovation is represented by the use of autologous hemocomponents and specifically platelet concentrate. But what is a platelet concentrate? Thanks to a platelet concentrate, we use a centrifuge to separate blood components and increase the platelet counts. Platelet concentrates are relatively new in medicine, and recently PRF has demonstrated to have many possible applications both in dentistry and in other fields of medicine, such as orthopedics, dermatology, and aesthetic medicine. PRF, Platelet Rich Fibrin, is a second-generation platelet concentrate biomaterial with a potential application in wound healing and can be used in oral surgery, periodontology, and in aesthetic medicine. It is obtained after a simple, easy centrifugation of blood in a dedicated medical-grade centrifuge. Depending on the centrifugation protocol and sterile tubes used during the procedure, the clinician has the possibility to select the desired type of autologous biomaterial to be used and produced. It is possible, for example, to obtain a liquid product to be injected or a solid one in case of need. In oral and perioral surgery, for example, it will be useful to search for a solid membrane to be applied over open ones to facilitate and foster the healing. In the present clinical case, a half-thickness periodontal incision is performed with diode laser to solve pathological periodontal traction operated by multiple frenums. After blood collecting and a proper centrifugation protocol, PRF membranes are used in combination with diode laser to obtain a fornixplasty and to increase the tissue quality and thickness. Some polyglycolic acid resorbable sutures are used at the end of the procedures to stabilize the autologous PRF graft. This is what we are able to obtain with this marvelous technique and modern technology after 60 days of tissue healing and maturation, thanks to the combination of PRF and diode laser. As above mentioned, PRF can also provide a liquid fraction to be used, for example, during aesthetic procedure of extraoral and perioral tissues, as widely described by several authors. Another clinical case here describes the simultaneous use of liquid PRF and diode laser in perioral tissue recontouring and volumization. Laser skin tightening and inner laser biostimulation effect can be obtained by the insertion of a proper sterile optical fiber in the subcutaneous tissue layer. This technique is known as laser non-invasive lifting. After this first laser passage, a further cellular metabolism biostimulation can be obtained with a PRF filler application with a completely autologous and biologically natural outcome. PRF is in this case properly injected through a cannula technique to elevate the nasogenian wrinkles and to obtain a moderate and natural volume increase of lip contours. As introduced before, we can clearly understand how much laser technology has affirmed its presence in various fields of medicine and stomatology. Another important synergy certainly exists with modern digital techniques and technologies, as intraoral scanner impression and smile design softwares. Patient comfort with intraoral scanner procedures we know is favorable, mitigating the discomfort associated with conventional impression taking. In oral and maxillofacial surgery, intraoral scanners enhance the airway safety during the impression taking. Intraoral scanners have improved various aspects of dental care but often requires the support of technologies to provide the best outcomes and in this case an efficient gingival retraction can be obtained with the use of diode laser, which can effectively help the clinician due to its hemostatic properties. Diode laser is able to reduce the sulcus bleeding and guarantee a drier field, favoring the evaporation of liquids. As introduced, different modern technologies and techniques show promising application and mutual interactions. Among these, the laser is certainly an instrument of great interest due to its well-known biostimulation effect, antiseptic properties, hemostatic and minimally invasive abilities. Different types of laser with specific wavelengths have been used in the past years in medicine. Between these we cannot list KTP and the YAG, erbium YAG, CO2, alexandrite and ruby laser. Between all these lasers, diode lasers are certainly known to the figure of dentist and stomatologist, and given their growing diffusion in the last 20 years, have been widely used in recent years also in aesthetic purposes. Initially widespread with a range of short wavelengths, today they range from 400 nanometers to over 2000 nanometers. One of the most versatile and consequently used wavelength used in medicine and in dentistry is the 950 nanometers. 950 nanometers is a wavelength able to work on the main acceptor chromophores present in the oral cavity and in perioral tissues, which are represented by hemoglobin, melanin, water, and adipose tissue. In modern smile design softwares, a mesh can help the clinician in the alignment process according to the midline and to other planes, just like as the bipupillar one. Transposition and rotation of pictures are at this point possible. It is now possible to determine the smile working area by easily tracing the lip contours with an assisted software technology. We can draw the smile line and also point our reference planes. We are able to plane our direct and indirect restoration, and we finally can present the outcome and discuss it with the patient. It is also possible to make measurements and draw arches on soft tissue to present future surgical intervention on periodontal tissues, just like in this clinical case. Guided and inspired by previous smile design software, we can complete our oral rehabilitation with a proper soft tissue refinement and remodeling. Gingivectomy and gingival recontouring procedures can be performed using a 950 nanometers diode laser equipped with a 300 or 400 micrometers optical fiber. The optical fiber can draw the desired incision easily, and the clinician can remove layer by layer the desired amount of soft tissue in a precise and gentle modality. The whole procedure can be completed in less than 1 minute without complication, pain, swelling, or any future complication. We can appreciate the final outcome of hard and soft tissue in this intraoral view, which represents a 14 days healing after the previous procedure. We begin now to understand how laser is among the main protagonists of these synergic modern therapies. The present clinical case describes the presence of a traction in lateral maxillary right frenum associated with a class 1 gingival recession. The approach to this pathological condition is mainly based on the elimination of the abnormal traction operated by the frenum and hopefully by the correct repositioning of soft tissues. By means of a 950 nanometers diode laser with a 300 micrometers optical fiber, a delicate and superficial incision is performed to obtain a half-thickness flap. It is clearly observable how diode laser helps the vision of the surgical field, providing a delicate and clear hemostatic effect. The correction of abnormal traction is now obtained with a diode laser incision with the parameters you can appreciate in these pictures. The whole procedure has been performed without pain referred by the patient, and sutures are necessary in this case only to provide and maintain the correct apical tissue repositioning. We can appreciate in this picture the healing after 7 days following the surgery, showing the formation of a stable fibrin clot richly vascularized. Also, a very frequent implant procedure, just like implant uncovering, can be obtained as described in this movie using a newer laser instrument represented by a sapphire monocrystalline tip which allows the surgeon to pilot the laser beam as using a pen in his hands. After the induction of a moderate amount of local anesthesia, sapphire conical tip gently draw and uncover the oral mucosa surrounding two maxillary implant fixtures. Using this instrument is really helpful for the clinician, essentially because there is no more flexion of the classic optical fiber, and because finally performing an incision is really minimally invasive, precise and easier than in past years. A case of upper maxillary frenum with an appendix is going to be removed due to the necessity of orthodontic treatment and for periodontal reason in this 28 years old female patient. The surgical procedure is performed under local anesthesia by means of 950 nanometer diode laser system. A 950 nanometer wavelength diode laser is in this case equipped with a sapphire prismatic shape tip. The tip is properly activated and started with a bluish paper before the procedure to increase its efficiency. The incision is performed enhancing the visibility of all the surgical area and increasing the control of tissue anatomical planes operated by the surgeon. The whole procedure can be performed without pain referred by the patient, with moderate or no bleeding, and in this case, with no suture. Clinical setting of power used in this case were of 2 Watt in continuous mode emission. The immediate appearance of the surgical wound with no bleeding or any sign of thermal damage can be appreciated in this picture. The present picture shows the healing after 7 days. And in this picture we can appreciate the healing after complete reepithelialization of the surgical wound and the maturation of soft tissues after 60 days. The blue line in this case underlines the previous attachment of the frenum in comparison with the new one obtained, highlighted by the pink line. As introduced before, diode laser can be applied in aesthetic medicine for the treatment of oral, perioral and extraoral tissues. So let's see some of the treatments that most commonly affect the figure of the aesthetic doctor in the areas of dental expertise. We can list bleaching, intraoral biostimulation, gum remodeling, low flow vascular anomalies, photothermal coagulation, skin biostimulation, wrinkle treatment, tattoo removal, perioral skin plastic surgery, and laser lifting. Due to the short time of this speech, I will only introduce some of these applications. The photobiomodulation is absolutely an interesting one and can be applied both in oral and perioral tissue. To be more repeatable and predictable, it is possible to use defocused handpieces specifically designed for extraoral photobiomodulation application. Handpieces such as those visible in these pictures, allow the clinician to unfocus the laser beam on extraoral tissues, allowing, for example, a non-invasive treatment of barcode and nasolabial wrinkles, as shown in these pictures. Another type of treatment that can certainly benefit from the use of laser system in the oral and extraoral field is certainly the low-flow vascular anomalies photothermal coagulation. Referring to the 2025 International Society for Study of Vascular Anomalies classification, we actually know that major part of low-flow vascular anomalies are located in the head and neck region. Most of these anomalies can be treated with a non-invasive approach, only if managed through laser techniques. Some second-level diagnostic investigation can be performed, just like dermatoscopic exam, which allow a better identification of the vascular pattern. In case of uncertain diagnosis or doubt between low flow and high flow flux, a echo-color Doppler exam may be carried out. Different techniques may be applied and eventually combined depending on the clinical situation. Thanks to the laser beam absorption operated by hemoglobin, we can obtain the microagglutination of endovascular red blood cells and also the sclerosis of vascular walls. Let's see how intraoral or extraoral low-flow vascular anomalies can be treated by means of diode laser in a non-invasive modality. In the present clinical situation, an extraoral vascular venous or capillary low-flow anomaly is situated between the nose left wing and the inferior orbital border. The maximum diameter of the lesion is 4 mm. A specifically designed optic for vascular application can be applied both intraorally or extraorally if needed. After the induction of a moderate amount of local anesthesia without vasoconstrictor, some impulses of laser energy are released until we assist to a sudden changement in the superficial color of the vascular anomaly. We must wait until it turns from violet to white, just like in this case. Then we have to wait for the progressive healing. We didn't use a surgical blade in this case, and we didn't perform incisions or we didn't use sutures. The time of recovery was fast without any complication. In the right picture, we can appreciate the healing after 60 days from the laser procedure, with no residual scars and with a favorable skin texture. Also, plastic surgery procedures can benefit from the use of modern laser system. The present clinical setting shows us the presence of a supposed nevus located not distant from the cutaneous TMJ projection area on the skin. Preliminary investigation based on dermatoscopic epiluminescence confirm our findings, and the presence of this nevus not only represent for the patient an aesthetic problem, but also under a functional point of view, because it often damages this anatomical area during the daily shaving procedures. This movie shows the surgical procedure, which is carried out using a optical fiber properly activated before the procedure. The diameter of the optical fiber used is 400 micrometers. The power used during the procedure ranges between 1.8 watt in continuous mode of emission to 2 watts in a pulsed mode of emission. It is absolutely important to provide to the pathologist for the histological examination a bioptic specimen larger than the implant base of the lesion. We must take 1 or 2 mm more to make it possible a correct diagnostic process. As you can see, there is no bleeding or moderate bleeding during the procedure, and the surgical suction is only useful to remove from the surgical area undesired smokes. The second surgeon or the second operator gently flush some cold air to diminish the temperature increase over the laser tissue surface. After the completion of the procedure, a sterile gauze is applied gently over the skin area, and the surgical wound is covered with a sterile patch, which must not be removed for at least 24 hours. Biotic specimen is then collected, measured, and therefore sent to the pathologist for histopathological examination. Pathologists revealed characteristic findings of intradermic nevus. The microscope slide revealed, moreover, some areas of tissue damage and minimal carbonization. The morphometric measurements were performed and revealed a microthermal tissue damage ranging between 300 and 500 micrometers. The microscope slide was considered by the pathologist adequate, with a complete lesion evaluability and a good margin evaluability. This aspect clearly demonstrates that diode laser can be considered a valuable instrument to be used in such surgical circumstances. The picture shows the healing after 7 days from the surgery, and there is a characteristic scab that shall not be removed, but gently disinfected daily until its complete disappearance. These pictures show the healing after 28 days and 60 days. At day number 60, there are no more residual scar, and there are no texture alteration on the skin, with a complete restitution of function and aesthetic. Also, piercing residual scars can be treated by using diode laser. Typically, a retracting depressed scar, accompanied by a characteristic umbilication, can be treated by using a microsurgical technique with diode laser. Diode laser can be used as a microsurgical instrument with a gentle application with low power energy, and after the surgical treatment of the scar, a biostimulation protocol can be applied. The picture on the right shows the healing after 7 days, after 14 days, and after 28 days. After 60 days, there are no more residual scars and a complete intact skin texture. In conclusion, we can affirm that the advent of new technologies and operative techniques has caused a significant change in the field of dentistry and stomatology. As shown in this lecture, scientific innovations involve diagnosis and both soft and hard tissue treatments, enabling clinicians to provide more efficient and effective therapies to their patients. From digital impression to sonic technologies, to PRF and especially to laser, technological advancements have transformed the way oral and perioral care is delivered, making it more accurate, safe, patient-friendly, and minimally invasive. Thank you for your attention.